Sir, we are good to go.
So, good evening, all. Myself, Dr. Kiran Varma, working as head of the emergency department, Yashoda Hospitals, Somajiguda. So, I welcome you all on behalf of Yashoda Group of Hospitals for the series of webinars conducted by Department of Emergency in association with the SEMI and Envoy. So, as you all know that, so we'll come up with an interesting topic every week. So, this time also we have an interesting topic. So, being a ER physician, then being ER resident, then being sitting in the emergency department, we see many toxicology cases. I strongly feel that we are the masters in dealing with any kind of toxins. Moreover, it is a bread and butter for us as well. So, with regard to the short introduction about toxicology, all those things. So, to discuss about, to enlighten particular topics, we have Dr. Befin. Okay, I'll introduce Befin. So, he is from Mookambika Medical Institute, Coimbatore. What is that? Sorry. Just hold on. Kanyakumari. So, thank you, Dr. Befin, for accepting our invitation to present here. And though I know you are a bit busy with your schedules and all, so thanks for being here to enlighten on a particular topic called hallucinogens. So, Dr. Befin, so can you take up the forum now?
Yeah, sure, sir. So, good evening, everyone. I'm good. Thank you to Yashoda Hospital and team for giving me an opportunity. And as lack of time, we will enter directly into the topic. So I think everyone can able to see my slide. Yeah.
Yes, we are able to.
Okay. So I'll start with my discussions. So I want our volunteers to raise questions or ask doubts at the end of the session. And first about hallucinogens. So first we have to know that the hallucinogens term and hallucination term is a little bit different. So initially they thought that hallucination and hallucinogens terms are quite same. But if you take only hallucination, it is only false perception of objects. Like, for example, a tiger will not be there, but people consider that a tiger is there. That is hallucination. But in hallucinogens, if you can get all kind of effects that have the capacity to alter the perception, cognition, and emotional states. And they call the other name of hallucinogens is psychedelic agents. So I think you can see the picture of it. A person is sitting inside a box, and she feels that everyone are talking about her, commenting about her. That means nothing is present, but she feels it is there. And whenever we talk about any topics, the history is very, very important. So first of all, about Santosh chemist Albert Hofmann, he discovered LSD in 1938. So beauty of it is, what he did was he discovered the LSD and he started to take for himself. At one point, he attained the dose of hallucinogen. Then he took the hallucinogen orally and he started to drive in a bicycle. He noticed different colors, different kind of creatures running around it. So that is how the Albert Hofmann discovered LSD. And from our old days itself, we know that some people are using some kind of hallucinogenic agents. For example, you take Agoras or Lord Shiva. They always use some kind of medicines for users. So my point is, before Albert Hofmann discovered itself, in olden days also, they were using this hallucinogenic agents. So main important classifications, which we are going to discuss today. One, serotonergic hallucinogens, methylated amphetamines, anticholinergic hallucinogens, and dissociative anesthetics and miscellaneous. So how hallucinogens are used? I think you all people know about like how OP compound is used. Like that, you take hallucinogenic agents, it can be absorbed through all the routes. For example, first is inhalation, followed by your pills, drinks, patches, and suppositories. So hallucinogenic agent, depending upon the type, the route of absorption also varies. And most common uses, recent days, recreational uses. Yes, in the like how in the get-together areas, or in the malls, they are using it. And spiritual pursuit, like how I told for Lord Shiva and Agoras. Artistic inspiration. That means once they take this drug, they feel that they are able to see some different colors, different creatures entering inside. So they used to draw it in a minimal dose. And therapeutic uses, they have used this for bronchial asthma, depression, anxiety, and stress-related disorders. So street names, yes, they call it as acid, boomers, hippie, pan, Superman, tar, and kanja. I think you people also would have heard about this terms. And first, we enter into serotonergic hallucinations. So serotonin hallucinogen, in the term itself, it is there, where it is going to act. It acts on the 5-hydroxytryptamine. Okay, so the drugs, whatever we are going to talk, all the drugs will be almost having a sympathetic drive. That means they'll be having a mydriasis, tachycardia, anxiety, sweating, ataxia, nystagmus, etc. So you can always remember the complications by remembering the sympathetic drives. See, just think when the patient is having repeated muscle twitching, obviously there can be a hyperthermia, coagulopathy. Yes, these drugs also can cause seizures and coma. As per USA, it is a substance owned by DEA. And LSD, we call it as acid, blotters, microdots, etc. It is derived from the fungus Claviceps purpurea. It is like very, very water soluble, colorless, tasteless, and odorless. The hallucinogenic dose is 20 to 30 microgram. If you people are seeing this picture, and I will tell you why I have added this. If someone takes LSD kind of drug, they'll be having a features like this. Okay, that means normally people used to hear sounds and see the images, but if they take the toxic dose of hallucinogens, actually they can hear the pictures, okay, and see the sound. It is exactly opposite. That is why I have added this. So main psychological effects: hallucinogens, hearing colors, seeing sounds, as I told, sensory distortion, paranoia, euphoria. And extreme use, it can take the patient to a bad trip, persistent psychosis, flashbacks, and psychological addiction. Very interesting point about all this hallucinogen drugs. It depends upon how people are taking. For example, if they are in a good mood, so this hallucinogen drugs will be taking them to the good mood. That means they will be feeling happy, they will be excited, they will be giving a positive response. But if they are in a bad trip, that means they won't hear your words, they can have suicidal tendency, etc. So, and after LSD, the important thing is psilocybin. So if you take psilocybin, the most active form is psilocin. Okay. So the good point about psilocin, even if you cook or if you have dried the psilocin component, the active component still persists. Okay. So what you people have to know is, even in the roadside, they used to sell some mushrooms. Before taking and cooking, we should know whether it is having some hallucinogenic effect or not. People say they can see that by seeing a color. That is usually psilocybin component will be green-blue in color. And about adulteration, I think many people are using in the recent days, but all that mushrooms are the normal mushrooms. People say they are adding the LSD into the mushroom for their hallucinogenic effect. And the same as LSD, it also has visual illusions and hallucinations. Toxic doses 5 to 100 mushrooms, that is approximately 4 to 6 mg of psilocybin. And before seeing before you people see this movie. I think everyone know this movie name is Apocalypto. Okay, so if you take Apocalypto movie, so some persons will be threatening. They will try to catch him. So what he will do is he will catch a toad, and he will take the secretions from the toad's skin and saliva. Then he will blow into the other person. Okay, that means the toad is poisonous. Okay, so bifitoxin, two main varieties, Befo alvarius and Befo marinus. It is found in the saliva, skin, and eggs of toad. People call it as lovestone or rock hard. And in some places, even they say that they used to lick the toad for the hallucinogenic effect. That is why they call it as rock hard. Okay. And many very important point about this Befo toxin is this toxin almost acts equally like a digoxin. Okay. So if you are taking more amount of Befo toxin, it can cause it can cause cardiac suppression and even death. So as it acts similar to digoxin, you can use digoxin specific FAB antibody. Even some models have showed that digoxin specific FAB can be used as an antidote for the Befo toxin. And next is methylated amphetamines. So methylated amphetamine, we call it as MDA, MDMA, or in sometimes they used to tell it as MDM. Okay. Methylene dioxyamphetamine and methylene dioxymethamphetamine. Yes, as I told initially about the sympathetic drug, this mechanism of action is catecholamine release at pre and post synaptic sites are inhibited. So what is happening is more amount of catecholamine is there. So more amount of hyperactive will be present in the methylamphetamine. So duration of action is 4 to 6 hours. So most common clinical effects, dry mouth, nausea, mydriasis, bruxism, jaw tension, ataxia. And in the recent days, when I am going outside, I am noticing this. That means when we are standing with some group, I'm seeing the youngsters are having a clenched teeth. That is bruxism. Okay, so they can clench, and even you can hear the sound of their clenching. So you please notice from next time if it is possible. So complications, hyponatremia, seizures, hyperthermia, arrhythmia, and rhabdomyolysis. And good point about MDM. Most of the times when they take MDM, they forget themselves. They forget to take water, and usually they do not pass urine at all. There is high chance that when they take MDM, they can go into an encephalopathy state because of dysalkyltemia also. And some people take amphetamine along with this, cocaine amphetamine. So high chances of myocardial infarction and IC bleed also is possible. And specifically about MDMA, it is synthesized in 1912 to enhance actually psychotherapy. Okay. But now recently it is used in so many malls, and that's why it is called as drugs of ecstasy, love drug, and date rape drug. And about date rape drug, if you take usually in movies and all they used to show, there will be some group of boys and girls will be there, and some persons will be adding some drug into that. Within 3 to 5 minutes, they lost their actual consciousness and emotional balance, and they forget where they are. That is why they have named that as a date rape drug. And most common illicit drug among general population because it is widely available, and sometimes it is also available through internet also. And available in 50 to 100 mg colorful and branded tablets, but it is very expensive. Toxic doses 70 to 300 milligram. Uses, it is used in psychotherapeutic agents, recreational, and at dance clubs. Yes, as I told about the day drug, the main reason why they have kept as a day drug is euphoria, increased emotional warmth, lowered defensiveness, and increased communicative ability. So once they take this drug, they do not feel unconscious. They will be conscious. People, the sideway people do not know that they have taken the drug. The main disadvantage, as amphetamine is also along with that, it causes severe vasoconstriction. I mean severe hypertension, intracranial hemorrhage, and ischemia. Chronic use can result in permanent damage to the serotonergic neurons. So if at all you receive a patient who is a drug abuse, who is taking some cocaine, amphetamine, or MDMA with myocardial infarction, so I want to know how you people actually treat it. So any volunteers? Can anyone tell if amphetamine is used, what is the treatment for myocardial infarction? Yes, anyone? Okay, so even you can treat like how we treat a myocardial infarction case. Even if needed, thrombolysis also can be done. Okay. Sorry, I'm not able to change the slides. Yes, next is anticholinergic hallucinogens. The most common anticholinergic hallucinogens are your Atropa belladonna and Datura stramonium. It is widely available in south sides, Tamil Nadu and in Andhra. Okay, because we used to receive patients of Atropa belladonna and Datura stramonium. So mechanism of action, it blocks the acetylcholine receptors. It is very easy for our medicos to remember this because you take any emergency decision, they would have used atropine at one point, at least in bradycardia, or at least when they treat the OP compound poisoning. So you know that what are the effects patient will be having, like metriasis, dry mouth, blurred vision, loss of motor control, increased heart rate, and body temperature. So antidote is isostrychnine. Duration of action, mostly it stands for 3 to 4 hours, not more than that. So anticholinergic hallucinogens. Actually, this picture is very nice one because we can easily remember the anticholinergics name. See, we have put a picture, blind as a bat. That means it causes mydriasis, so they cannot see it properly. Red as a beet. That means flushing will be there. So that is red as a beet. And dry as a bone. They'll be very dry because if you give atropine, you would have seen, right? They'll be become their secretions, everything will come down. So that is dry as a bone and hot as a desert. So because of hyperthermia. So once again, I will tell one is blind as a bat, mad as a hatter, red as a beet, dry as a bone, and hot as a desert. Okay. So important points about anticholinergics. I think you'll be knowing about glycopyrrolate also. It do not cross blood-brain barrier, but atropine crosses blood-brain barrier. So low doses can be used for variety of medical purposes, as I told for bradycardia and your OP compound poisoning. High doses leads to medullary paralysis and coma. And we have a personal experience when one of the person has come with the OP compound case. So we gave atropine, followed by he started to tell the truth. That means in olden days, they have used this as a truth serum. Okay. So about Atropa belladonna, you can see the girl's eye. It is beautiful. So the name actually named from this queens. So in olden days, what has happened is when the king comes, the queen used to show her that she's beautiful. So they used to take the seeds of Atropa belladonna plant and put on the eye so that they'll be having a pupillary dilatation. So they think they will be looking so beautiful with it. So that's how the name Atropa belladonna came. So Atropa belladonna, it is also known as devil's herb and deadly nightshade. And it is used as a truth serum in olden days. Even police people have used before. Currently, they are not using it. And all parts of the plant, including root, stem, flowers, seeds, everything is poisonous and also hallucinogenic, depending upon the dose. Most toxic is root. So each berry, you take one berry, it almost has a 1 to 2 mg of atropine. It is used as a hallucinogens by adolescents, but recently it is very less. Large doses, as we discussed, persistent tachycardia, hypothermia, hallucinogenic effects, depression, loss of consciousness, and coma. And Datura stramonium, you can see it is so beautiful. They call it as devil's trumpet, okay? And some people call it as angel's trumpet, Jimson's weed, thorn apple, etc. So among this, as in Atropa belladonna, root is very poisonous, but in Datura, seeds are poisonous. Each seed contains 0.1 mg of atropine. The fatal dose is 100 to 120. you know how people used to take, or some farmers used to give this to animals, okay, especially cows, etc. What they used to do is they will take the seed and they will grind it properly and they will make it to drink. And this effect lasts for almost 8 to 18 hours. And dissociative anesthetics, main drugs, dextromethorphan, phencyclin, and ketamine. As an emergency physician, I think you people will be using this drugs regularly. Okay. For example, ketamine. So ketamine, it acts as a NMDA receptor antagonist. So 1 minute. Hello. 5 minutes left. So duration of action is 4 to 6 hours. So ketamine, if you use opioid, you must always remember opioid overdose. So opioid overdoses, your medulla bleed or infarct will be having a mnemonics. They used to tell 3 P's. One is pupil. Second one is paralysis. Third one is hyperpyrexia. These are the 3 P's which we remember for. One is pinpoint pupil. Another one is respiratory paralysis. Third one is hyperpyrexia. So common clinical features: small or mid-sized pupils, nystagmus, muscle rigidity, hypersalivation, agitation, and catatonia. So complications: coma, seizures, hypothermia, rhabdomyolysis, hypertension. You take any kind of dissociative drugs or any hallucinogens, in all the areas, the most common complications are your seizures, rhabdomyolysis, hypothermia. Okay, even for at some point of view, you can remember like that. So include phencyclin and the related compound ketamine. And yes, in ED, we commonly used as an induction agent, and also we also use for our procedural sedation. And refractive bronchial asthma also, you can use ketamine, etc. So ketamine, known as vitamin K or special K or Kit Kat and Cat Valium. Yes, I know so many names are there, but you people can keep 2 or 3 names to remember. Okay. The most common use of straight ketamine is insufflation. And psychological effects includes euphoria, confusion, dissociation, hallucination, etc. Extreme, yes, cardiac problem, psychosis, brain damage, and seizures. And about ketamine, we call it as dissociative anesthesia drug. If you have, I think you would have experienced this. You give some drug to them, one analgesia will not be there, followed by they will not be in the real world. Because we have seen a case who has taken us to Dubai and came back here. So ketamine is a good dissociative analgesia drug. And last drug I would like to tell our marijuana. Yes, most common name of marijuana is ganja. We see very common nowadays. So mechanism of action, the tetrahydrocannabinol activates the cannabinoid receptor. That is the reason for your marijuana. Common clinical features, once again, tachycardia, conjunctival congestion, bronchodilation, orthostatic hypertension, impaired motor coordination. And complications, acute psychosis and panic reaction. That is how in recent days so many fights are happening in the roads. Marijuana, most common illegal drug in the world currently. Yes, I told already, people use this for inhalation, dope, boom, gangsters, etc. And it is having actually a active substance. We call it as cannabinoids. Okay, it is derived from the plant Cannabis sativa. So in the olden days, they have used this for glaucoma and for nausea, even for analgesic purpose also they have used this. And complications, drowsiness, euphoria, heightened sensory awareness, paranoia, distortion of time and space. So diagnosis, we have come to last part of it. Yes, as a ER physician, we always go with our complete airway, breathing and circulation part. If you have a lab in your hospital setup, you can send for blood serum level of LSD, MTM, etc. if at all you have. But you can get actually hint by a short history and their symptomatic signs, and mainly by doing a CPK value. So if the patient is having a hypothermia, you can have an increase in CPK, rhabdomyolysis. but this is not a definitive investigation, because you take any IC bleed or any sepsis patients, even they do have increase in CPK value, but it will give you a hint. And ECG monitoring, mainly we can see the electrolyte disturbances and QRS binding. Urine specific radio immunoassay and enzyme immunoassay technique if it is available, and serum digoxin immunoassay for before touching. As I told, it mimics digoxin. And treatment, yes, it is like ABC technique. Okay, so first, always obviously airway. You are receiving the case in a coma state, or the airway is not patent. You can always go for your bag and mask ventilation or endotracheal intubation if needed. Once the excretion is there, is obviously the patient is going to respond. Yes, breathing part. Sometimes they used to take inhalational techniques, and at that point of time, they can always have a barotrauma. Even pneumothorax, they can come. Some pulmonary contusions are also reported. That is about B. Circulation, yes, we saw hypotension. Okay, mainly orthostatic hypotension and dehydration. You can go for a fluid boluses, preferably normal saline 0.9%, 30 ml per kg if fluid bolus is needed. And the GI decontamination, if person presented within 1 hour, yes, it is really benefited. But most of the hallucinogen cases will not present in 1 hour. So active charcoal and gastric wash really do not help. And D, if you think disability and seizures, you can think of. And the best drug for seizures is benzodiazepine in case of hallucinogens. And all others are symptomatic management. And as I told, patient also can have IC blade, go for scans, CT brain, etc. And myocardial infarction, yes, you can go for antiplatelets, angiogram if needed, angioplasty also. And yes, as I told, LSD is one of the DEA drug enforcement administration. As per drug enforcement administration, it is a Schedule 1 drug, and most of the hallucinogen drug which I have told now is a class 1 DEA drug. And about good trip and bad trip, this is the last slide for us. So as I told, the world can seem so beautiful, even if they take a small dose of hallucinogens. But the point is, their mood has to be in a happy. If they think I am happy, they will be having good trip. If they feel they are so sad, then they will be having a bad trip. About good trip, the world can seem beautiful. Life can seem wonderful. Human interactions can seem so deep and meaning. They will listen to every words. But if at all, if it's a bad trip, can bring overwhelming feelings of fear. The world can seem harsh, cold, and ugly for them. Life can seem more painful, and people can seem superficial and cruel. Okay, and thank you. Now I think if everyone are having any doubts.
Thank you. Thank you, Dr. Befin.
Thank you.
So thanks for enlightening on hallucinogens. So undoubtedly that is a fantabulous talk. So I think you touched each and every aspect of hallucinogens, including atropine belladonna, then datura, then regarding that apocalyptic movie.
Yeah,
that was a nice one. Then marijuana, LSD, all these things. Thank you so much.
Actually, I know it is very short slide because there are so many hallucinogens drugs. Even I have deleted some 10 drugs after preparing. I felt it will be like kind of boring. That's why I reduced so that at least. But these are the important drugs which we have discussed. We must.
Yeah, true. So though it is a short, it is very crisp. You're onto the target.
Yeah, thank you.
So you make it really attentive. Then if you have any questions, we can take up. We'll wait for some time.
Yeah.
So we'll see. Then Befin, so how frequently do you see these hallucinations in your department?
Sir, actually, I am in a rural area, this place. We actually see Kanja, but no one will be ready to get treated from us because they know that the things how it will happen is a poor family will get this son at the late night to us, stating he is not responding and he got 1 episode of seizures and he will be having all kinds of seizures, tongue bite, uprolling of eye movements, everything. But if you ask for the treatment, they will be tell, no, last week also it came, it got settled. So if you ask for the MRA or EEG, they won't be acceptable. And we do know that next day morning, if the airway is protected, he will be saved. So personally, if you ask, we are seeing Marjuna Kanja cases, but LSD MDM is very, very less in this area, sir.
Even same here too. So we see sometimes there are mixed hallucinogens which
Yes.
they consume. Usually they don't reveal the history at all.
Exactly. Yes.
See, they give some lame things, no? So they tell that I was apparently normal till half an hour back. Then all of a sudden I got headache, then
Yes.
nausea, vomiting, then I feel drowsy. So they tell that it happened all of a sudden.
Yes.
So when though we dig the history, they didn't even reveal it. So that is the biggest drawback. So where we have lags.
And the place where I previously worked, actually, I have seen a death, but it's not sure. Mostly the case is because of amphetamine, cocaine with amphetamine. Because he is around the 24-year-old male who got a sudden history of chest pain after a party, and they brought to him in a broad dead condition. But we do not have proof to tell whether it is amphetamine or not, because their friends actually revealed a history that they were taking drug. So, but even we do not know what happened later. But some experience we do have here, sir.
Yes, actually, I have seen one case about 3 months back.
Okay.
He was a young guy, about 25 years old, young guy.
Okay.
He presented here with history of drowsiness and on of giddiness, something like that. He feel low under. Then on examination, his BP was around 60 by 40. Then we have examined him thoroughly. We tried to find out the reason for hypertension, but we couldn't find out. Then, so we have given the fluid. We have given nearly about 4 liters of fluid.
Okay. Okay.
Despite giving 4 liters of fluid, the BP didn't improve.
Okay.
Then we are also in confusion. So what could be the reason for hypertension? So how to improve the BP? Shall we start vasopressors or to continue the fluids? Then we treated him for almost 2 hours.
Okay. Okay.
So then we started asking about all toxicological things and all, like consumption of these things, marijuana, LSD, cocaine, all those things we asked. But he denied for each and everything he denied. Then after some time, his parents came. Then when we inquired with them, they told, they revealed the history. He consumed almost 4 to 5 different things like LSD, cannabis, marijuana, cocaine.
Okay.
So he consumed multiple. He just name it. So they brought different packets, right from sniffers to everything. They brought different things, which is stored in his bag.
Okay. Okay.
So then what to say? Then we came to know that. So these multiple things which made him to become hypertensive. Then we treated. Then we advised him for admission. He doesn't want to get admitted. Then attenders, parents also not willing. So moreover, they are from high-end background. Like his parents are IAS and IPS, so they don't want to do anything.
And
so high category people.
And to our residents, we need to tell one important point about when we are dealing about any toxicological cases, or when we are dealing about any kind of undiagnosed cases. Always our documentation should be perfect.
Yes,
because tomorrow even their parents can come and tell, no, we did not reveal so and so histories. So we always should maintain medico-legal cases, AR and MLC, like police intimations, etc. Because it will really help us tomorrow. If not today, it will help us tomorrow. Yes.
So then one thing, see, whenever history is not matching with your clinical examination, clinical findings, always suspect toxicology. Always. So suddenly, all of a sudden, they tell that, so I was upper normal till 10 minutes before, then it happened suddenly. So when your patient history or bystander history is not matching with your clinical findings and examination, always suspect toxicology, whatever it could be. So to be on safer in such cases, go to the MLCs.
Yes.
So I have seen many cases like that. So they give all distracting histories only. They will try us to deviate from other things.
Yes, sir.
I think we got one question here. So let me see.
Yeah.
Yes, there is a question from the one person. If a patient present with history of consumption of multiple drugs, which drug do you first suspect and how to start the treatment?
Actually, if you are thinking about hallucinogenic agent, you can always think about, as I told, MDM and LSD is most common. But if you ask about multiple drugs, nowadays you take benzodiazepine drugs are most common because so many people are taking sleeping pills, alprazolam, for example. So first, always think of the most common things like benzodiazepine drugs and opioids. Now it is actually available. Next is our opioids. Then think about your MDM, LSD, etc. And how to start this treatment? You take only for benzodiazepine, you have antidote like flumazenil. Otherwise, you do not have a specific antidote. It is actually a symptomatic management. Okay. I think I have come to your point. You got the answer. And before toxins, we have seen only in books. Obviously, we are not going to treat the patient with the drugs in FAV. No other drugs are having antidote. So think of common, benzodiazepine is the most common drug which we face.
So yes, if any, if a drug is unknown, the compound which he consumed unknown, then presented in coma. So as per our Tintinali, as per our emergency books, there is a cocktail called coma cocktail.
Yes.
So you can use that one. So like 100% oxygen, then naloxone, glucose, and thiamine. So that is a coma cocktail, what we use if you don't know the what compound he has consumed and all. So that you can try with. So there is one thing like thiamine, glucose, and naloxone. Those things you can try with. Any other questions?
I think our PGs understood everything, sir. That's very
They understood everything. It might be good. So
okay.
I think no questions as of now. So once again, thank you, Dr. Befin, for enlightening on hallucinogens.
Thank you very
So
much.
I'd like to thank Dr. Srinath, sir. Yes,
and thank you, Srinath, sir, especially because he gave me recently only I met him and sir gave me a good forum for me to have a talk. Thank you very much, sir. And thank you, Yashoda Hospital.
Thank you, Dr. Srinath, sir, for creating such a great platform to share our knowledge and to get acquainted with multiple people, to get the knowledge from the other side as well. And thank you, Dr. Yashoda Hospital. Thank you, Yashoda Hospital Management, for supporting in each and every aspect. I will also thank Dr. Semi and Anboy for supporting in each and every aspect in our Yashoda Hospital webinars journey. So last but not the least, so all the viewers. So this webinar is getting success. We are running successfully only because of your participation. I thank one and all for your participation. So if you have any questions, you can send me a message or anything like that in person. So you can try to answer it. So this same thing is available on Facebook as well. Just watch it. If you have any doubts, please get back to us. We'll try to solve it out. Thank you, one and all.
Thank you.